High blood sugar causes two types of complication. One is diabetic ketoacidosis, the second is hyperosmolar coma. In type 2 diabetes as well as type 1 diabetes, high blood sugar many times leads to diabetic ketoacidosis. In this, acid gets formed in the blood because of breakdown of fats, resulting in acetone and acetoacetic acid coming into the blood, and that causes infections, generally respiratory or urinary infection. This condition is a medical emergency, and if not promptly treated can lead to morbidity and mortality. Long-term complications resulting from diabetes will be because of high blood sugar resulting in microvascular complication as well as end organ damages. Diabetes, if kept high, results in microvessel complications, and that causes damage to the heart, kidney, the nerves, eyes and brain, and also to the muscles, bones, liver, etc. In the brain, diabetes can cause strokes. The incidence of stroke is much higher in a diabetic than in a non-diabetic. Also, small vessels in the brain might get blocked, and this microvessel blockages in the brain can result in memory loss leading to dementia. In the heart, diabetes can block the vessels of the heart because of coronary artery disease resulting in heart attacks. Microvessel damage in the heart can cause dilatation of the heart, causing cardiomyopathy. In the kidneys, the earliest sign of damage is a loss of protein in micro amounts in the urine, which is called microalbuminuria. If the sugar is not kept under control, the blood sugar damages the kidney, resulting in permanent chronic renal failure. This may require hemodialysis. In the eyes, diabetes can cause cataract, and it can damage the retina also, resulting in diabetic retinopathy. Cataract will require cataract removal surgery, and retinopathy will require laser photocoagulation. The nerves of the hands and the feet can get damaged, known as peripheral neuropathy. Initially, this causes tingling and numbness feeling in the feet. As the damage worsens, the feet become totally numb. The numb feet can get trivial injuries which may go unnoticed, and this can result in ulcers and gangrene of the feet. If unchecked, this can result in amputation of the feet or the leg. The nerve damage in the internal organs, that is the intestines, is known as autonomic neuropathy. Autonomic neuropathy causes altered bowel habits, that is alternate constipation and diarrhea in a diabetic patient. Diabetes also affects the other organs of the body. Lack of blood supply to the muscles, and because the muscles cannot utilize blood sugar properly, the muscle bulk shrinks, resulting in atrophy of the muscle. Hence, typically a diabetic will have very thin upper limb and lower limb and a very broad mid segment. It also affects the bones, causing osteoporosis or reduction in calcium in the bones, and that can cause weak bones and cause fractures. The ligaments of the joints can also get affected, resulting commonly in frozen shoulder. Frozen shoulder can be corrected with exercise. However, if it is not treated early, sometimes it requires surgical intervention. Hence, you can see that diabetes can result in multiple complications in our body. The good news, however, is that if properly controlled, the complications either do not occur or they are delayed. Diabetes can knock off 7 years of your life. However, again, the plus point here is that if you properly control your diabetes, that is, if you keep the blood sugars below 150, whether you check the fasting, post lunch or the random blood sugar, then the chances of complications become very less.